The type of dentistry that I perform and have been trained to perform over the years is called equilibration dentistry. There are two schools of thought on, on dentistry. We have hand floating, which is the act of addressing sharp points in the horse's mouth with 3-inch blades on handles. And it does help the horse. Every horse will have a different mouth. Some horses will have more problems, obviously, than others, much like people might have overbites, underbites, and things of that nature. So the type of dentistry that I perform is called equilibration dentistry. Equilibration dentistry doesn't only involve floating, but it addresses the chewing surfaces of all the teeth. So what we're looking for in equilibration dentistry, and every mouth is going to be different, but our final result, we want all of the cheek teeth and all of the incisors to be of a consistent height. And this will allow for optimum performance, not only with grinding and eating, but also from a performance standpoint, so that we don't have inhibitions on jaw alignment, movement front to back, and side to side. An older horse, on average, that hasn't had equilibration dentistry will have more malocclusions than younger horses. That doesn't mean that a younger horse can't have a horrific mouth. They certainly can. But on the law of averages, we'll say if your horse is 10 to 15 years old and has never had equilibration dentistry, the malocclusions are most likely going to be greater in that mouth than they would be in a 5 or a 6-year-old. Once the doctor has sedated the horse, we go in and flush the mouth out, make sure there's good visibility inside the mouth. So after flushing the mouth, we want to get a good examination. So it's best, I feel, I can get a good examination of the incisors, the front teeth, when the horse is sedated and the head down. And the first thing I'm going to look at is the plane in which the incisors meet. If I were to stick a credit card between the incisors, that plane, typically we want to dissect the TM joint. In this case, we can see here on brown where that plane comes right in front of the eye. Now the reason for this is we want good rostrocaudal movement of the mandible, front to back movement of the mandible from a performance standpoint. So when I'm looking at incisors, that's one of the first things I want to address. So the first thing I do is make sure his eyes are level. I want to see the alignment of the incisors, and I can tell right now his midline is off to the right, maybe a couple of millimeters. If we look at the midline right here and the corresponding maxillary midline, we see we're offset to the horse's right by a millimeter or two. Now, significance of this comes more from a performance standpoint, and the alignment of the jaw we typically want centered. From a riding standpoint, the reason for that is the neurologic function of the trigeminal nerve, which runs through the TM joint. So the whole goal here is that we have proper rostrocaudal movement of the mandible and also good side-to-side movement of the jaw without an inhibition of a movement from left to right, because as the horse bends right or bends left, the mandible has to shift that direction. All right, so I have a diamond wheel which will help me create the plane, work on the occlusal surface. Now initially what I'll do is just gap the incisors open with my hand at the diastema or the bars of the mouth. And the disc, I want dissecting that TM joint. So the surface of the disc should be aimed back to the TM joint. It has a very slight diagonal. This tooth was a little long. I reduced it lightly. So I'll come over here to the left side. All right, so the next thing I will go to is a different instrument. a rotating burr, which is coated in diamond, and just finish the alignment on Brown here. So I can, with the burr, I can get back on the back side of the occlusal surface. All right, now we can see here what I did was reduce the corner mandibular incisors. Really didn't touch the maxillary one. These teeth, he's young, these teeth are actively erupting. What's going to happen is these two teeth will join and be in occlusion probably within 4 to 8 weeks. At his part of life he's in right now. These are new. These come in, the corner incisors come in at 5 years of age, 4.5 years of age, usually in full wear by 5. What we want is all these cheek teeth to be consistent in height. And when we have overworn areas and overlong areas, the bite fits together more in a puzzle fashion, which will dictate every time how the mouth occludes. We hear concerns all the time of motorized instruments, and yes, they can be dangerous, but they can also be very, very beneficial and very safe at the same time. And here we have a rostral hook. So while I'm in here with this, I go ahead and take care of the floating, or the initial floating, which we would normally do with a hand float. This type of dentistry has two major benefits. Obviously, the health of the mouth. We want to preserve the teeth for a lifetime and avoid molar extractions. But the other benefit to an equilibrated mouth is no inhibition of physical performance. So I'll use initially a cheek retractor, slide the cheek over, move the jaw over, and I want to see as much level contact across the chewing surfaces down the arcade right here, which is what I see. I have a fairly good, I don't see any premature strikes anywhere. So the final approach here is just to finish off with a hand float. From a performance standpoint, when the owner, Jessica, rides Brown, she may have been noticing some issues with him, maybe some hang-ups to the right. Typically what we'll see with a mouth like this and hooks is the inability to maintain a round frame. So you know, by equilibrating these cheek teeth, it'll allow the horse's jaw to slide forward and allow this nerve function through the joint to stimulate the muscles that need to be stimulated for maintaining a round frame. So I would suspect that Jessica will notice a more free way of maintaining a round frame